We are recording today's session so that board members who weren't able to make it now, there's Maeve, welcome Maeve, would be able to view this at another time. Thank you for joining us. This is a little bit of an experiment on our part, but we have lots of new board members and we thought it might be nice to feature a different agency once a month, provide a little overview of our agencies and an opportunity for people to ask questions. And also, as we talked about, to be able to record it and people could watch it also at their convenience. I'm going to get us started. And you can move it ahead. Thank you, Marissa. Just a reminder that we're able to hold these sessions via Zoom and still be under compliance with the sunshine laws, Ohio sunshine laws. If these sessions are informational only, so we'll just ask people to remember that this is not any kind of discussion about the merits of a provider or any decision making. This is informational only. You're certainly welcome to ask questions. That's part of the purpose of this, but we won't be doing any official board business or conferring among board members as a part of these educational sessions. And then you can shift it. So the format for today's session is a brief overview that we're going to do at the board just to set the context for all of our agencies. And then our provider, Mark Breidenbaugh, will do a 10 to 15 minute presentation, and then we'll have 10 to 15 minutes for questions. So we're hoping to keep this to about 30 minutes. As an overview, Hopewell Health Centers is one of our main contracts here at the board. In state year fiscal 2021, we provided them with over $2.6 million, which is a combination of federal, state, and local levy dollars. Hopewell Health Centers is our lead community mental health agency for persons with serious and persistent mental illness, which means that if somebody doesn't have Medicaid or private insurance or they're underinsured, the board provides funding to Hopewell Health Centers to be able to meet the needs of those persons in our communities. So we provide that subsidy for people who are uninsured or underinsured. Hopewell Health Centers also plays a very important role because they do our crisis services for the board area. And they provide a very important role related to Chapter 5122 and the hospitalization of persons who have serious mental illness. So there's a lot of statutory duties that the board has that then we contract with Hopewell Health Centers to carry out on our behalf. So I think this isn't any surprise to anyone, but Hopewell Health Centers is a really primary partner for us in terms of the work that goes on in the board area. Next slide. I'm not going to go over this slide, but this is just a very high level and quick overview of the services that are provided by Hopewell Health Centers and the number of people that were served in 2021. And we can email these slides out to you so that you have it. And if there are follow-up questions, we can put it back on at the end too if you want to go back to anything or ask any questions. But I just wanted you to know, just at a high level, the types of programs that are provided by them, a very large range of services, and the numbers that were served in 2021. And with that, I would like to introduce Mark Breidenbaugh, who is Executive Director of Hopewell Health Centers, and he has a PowerPoint and we'll go over the services that are provided by Hopewell, and then we'll have time at the end for questions. So Mark?
All right, thanks Diane. When, as Diane said, I'm Mark Breidenbaugh, CEO with Hopewell Health Centers. Sherry Shamblin, who many of you probably see at the board meetings, wasn't able to join. She had a mandatory school-based health center call. Sherry is our Chief Strategy Officer, and I'm pinch hitting today for David Schinkelberg, who was supposed to deliver this, but had a last minute family situation he had to take care of this week. So David is our chief clinical officer and is sort of over all of our specialty behavioral health. And then we have Dr. Carr, who is our chief medical officer, who is over all of our medical and dental services, all of our prescribers. And then Brad Nelson is our chief financial officer. So that's our executive team, even though they couldn't all be with you today. Just wanted to give them a little bit of a shout out. So Hopewell Health Centers, you see our access there at the bottom of the screen. It's to provide access to affordable, high quality integrated health care for all. That's pretty all encompassing. And when we talk about healthcare, we're talking about primary care, physical health, we're talking about behavioral health, and we're talking about oral health. And that lines up with our vision statement here of a community where everyone enjoys a healthy body, mind, and spirit. It's that total wellness that we're really trying to achieve. Next slide. So here's a slide of our service area in our counties. I'll focus primarily on the blue pins there. I think that's blue. The darker pins in a 9-county service area there. The additional yellow pins are where we have community-based services with our early childhood mental health team. We don't have physical locations in all those counties. They do more home-based services in those. But the 9 counties with the blue dots there are our primary 9 counties. You can see that the Athens-Hocking-Vinton area there kind of lies right at the heart of our service area. Next slide. So what is Hopewell? So we formed in 2013, but the roots of the 2 organizations that formed Hopewell go back to the early 1970s. Family Healthcare was a federally qualified health center that served 6 counties that started in 1974 under the Ross County Commissioners, actually, here in Ross County where I am. And then Tri-County Mental Health, which started in Athens, was a community mental health center that formed in the early 1970s. We combined those 2 organizations, renamed it Hopewell Health Centers in July of 2013, and have been working on this integrated primary care and behavioral health for the last 9 years or so. We've grown a bit over that time. You can see that we also had Woodland Centers, which was serving the Gallia Jackson Meigs service area there. They also became part of Hopewell on January 1 of 2018. And you might ask why Family Healthcare and Tri-County combined. We started back in 2008. Family Healthcare started contracting with Tri-County Mental Health for behavioral health services because of just cuts through the mental health system over time. We were having difficulty getting folks in who were not Medicaid covered, so uninsured folks, Medicare covered folks, private insurance folks. So we began contracting with Tri-County in 2008. Initially in MacArthur and Vinton County, and then in the Plains and Athens County, and then in Logan and Hocking County. After a couple of years, so about 2010, we realized that, we were still 2 separate organizations. It was really co-location, not integration. And we were really 2 separate organizations. So sharing patient information, we had to get releases back and forth, had 2 different organizations with working under 2 different sets of policies and procedures. So we really thought there could be a better way. So about 2010, we took our boards, representatives from each board, representatives from each management team down to Cherokee Health Systems in Knoxville, Tennessee, which was a community mental health center and also an FQHC, and had been so since the 1980s. So they had quite a bit of experience, and that sort of launched the discussion that ultimately led to the 2 organizations combining in July of 2013. And then sort of similarly, that led to the Woodland Centers in January of 2018. As I said earlier, Family Healthcare had 6 counties that they covered. Tri-County had 5 counties that they covered, but we overlapped in those main 3 counties of your board region, which is that Athens-Hocking-Vinton board area. So once we combined, we had 8 counties. When we brought Woodland Centers on, that added Gallia County to that mix. So a total of 9 counties now. And all of our sites are considered federally qualified health centers, which is a designation through the Health Resources and Services Administration, HRSA, as we call it. We're also accredited by the Joint Commission and Ohio MOS, certified as a community mental health center. We're recognized under SAMHSA as a certified community behavioral health center, and we're credentialed as a patient-centered medical home, or PCMH. You may have heard of that through the National Committee for Quality Assurance, NCQA. Next slide. So what's an FQHC, or federally qualified health center? If you've never heard of those, you may kind of wonder what they are. It was actually created back in the late 1960s under federal statute, started under the President Johnson administration, I think in 1969. There were a couple of pilot projects, and then the program grew pretty tremendously during the 1970s, and then again in the early 2000s. And of course, the Affordable Care Act also led to the growth of the program. But it's a federal program, but it's a public-private partnership. So the federal government, HRSA, the Health Resources and Services Administration, contracts with local community-based organizations like ours, nonprofits. Some are also health departments, but contracts with them to run this nationwide program. So they're nationwide. They're about 1,400 health center organizations with 13,500 delivery sites. They employ over 250,000 staff and serve nearly 29 million people annually. So that's a bit about the health center program and what it does. There are some very specific, and I won't go into all the details, but there are a few of them listed here. There are some very specific rules and regulations for being a part of that program, being a grantee under that program. And one is that our board has to be made up of a majority of consumers. So actually one more than half. So 51% of our board has to be patients that utilize our services. We have to provide all services to everybody regardless of ability to pay, and provide a sliding fee discount to anyone below 200% of federal poverty level. We get about $5 million a year through a grant through this HRSA Health Center program. And that allows us to leverage, additional dollars that are coming from the board and other sources to provide services to those that don't have the means to pay. Our total annual budget is about $70 million. So 5 million on 70 million is only about 7% of our total budget is comprised of our HRSA budget. Most of our funds are generated through fee-for-service to Medicaid, Medicare, private insurance folks. There are a lot of, like I say, rules and regulations around required services and quality programs and credentialing requirements and different things that health centers have to comply with, data reporting requirements. You can find out a little bit if you want more detail. I won't go into all of it, but you can go into the bphc.hrsa.gov. That's kind of the main website. If you go there, and then sort of this additional layer of detail gives you more information about specifically what a health center is, but you can find a whole lot of other information on that bphc.hrsa.gov website. And then one of the requirements I talked about, data reporting, you can actually see our annual uniform data system submissions. You can see the nationwide roll-up, you can see the statewide roll-up, you can even drill down to Hopewell's data, and the link that's been provided there is to our most recent one. That would be for 2020. The 2021 data should roll out here in the next couple of months. So if you're interested to see that, and that provides information about the patients that we serve, about the services that we provide, about cost data, about clinical quality data, a whole host of information is available there. Next slide. So again, I talked about, we serve 9 counties. We have 30 clinic sites in those 9 counties, so a few more than one site in each county. We have early childhood services that were those, I believe the dots were yellow on that pin map, in an additional 10 counties where we don't have physical locations, but provide more home-based services. And we have 5 school-based clinics. One will be opening up this fall in Nelsonville, York. And we have behavioral health partnerships with 22 school districts that are in addition to the 30 clinic sites we had listed there. Again, we have 713 employees. We do have a number of open positions, either those that are vacant because of attrition, or we're adding additional sites and services. So I think we've got about 100 positions open. So if we were fully staffed, we would be well over 800 employees. Next slide. So in 2021, Diane shared some information there on some of our very specific behavioral health services like crisis and things like that. But overall, we served almost 40,000 people across our 9 county service area in 2021. That number was 39,240. It was pretty consistent with our 2019 number, which was 39,400 and something, I believe. We did dip a bit during 2020 because of COVID. We were down around 36,000, but we've stayed pretty consistent for the last couple of years. So out of that 39,000, 20,533 would be primary care patients, 15,176 would be behavioral health clients, 9,000 would be dental patients or oral health patients, 900 substance abuse treatment services, and then 339 other allied health professionals like speech and language therapy, occupational therapy, physical therapy, and nutrition. If you add those numbers up, they will total more than the 39,240, and that's because people may receive multiple services from us. We don't require that, somebody may only come to us for behavioral health services. Somebody may only come to us for dental services. Somebody may only come to us for primary care. We don't require them to, be primary care to get into behavioral health or dental. So they can access us. We had a philosophy early on of no wrong door. Some of our sites are more focused on, like 90 Hospital Drive, they sort of originated more as a behavioral health focus. And folks may think of that as their health home for behavioral health, but we've implemented primary care in those locations as well to take care of those physical health needs. And then we have sort of what were more traditionally primary care locations, physical health locations, that we've also embedded behavioral health inside of and do referrals. We share one single electronic record throughout the entire organization. So no matter which site or which services you're accessing, we have access and are able to share that information among all of our staff. So next slide. So here's a little bit about payer mix, and this is overall payer mix. You can see that the larger blue, just under half there, is Medicaid. So this would look a little bit different if we drilled down into specific services, but this is overall. So we have just about half, slightly under half, that are Medicaid covered. We have another quarter, maybe 30%, who are private insurance covered. We have about 15% that are Medicare and about 10% that are uninsured. If we look at dental, for example, there isn't a Medicare benefit in oral health, so we have more uninsured in dental and more Medicaid in dental because of that lack of a Medicare benefit. Our behavioral health services would slant more towards higher Medicaid coverage as well. So next slide. So in 2021, out of those 39,000 folks that we served, about 25% were, children, adolescents, sort of those 0 to 17 populations. Another 61% would be adults in the 16 to 64 category, and then 14% would be adults that are 65 plus. Next slide. So the services that we provide, I talked a little bit about sort of the focus of some of our sites that may be more primary care or behavioral health focused. But, when we talk primary care, we're talking physical health, and that would include acute visits. So when you're sick and, need to go see the doctor, or nurse practitioner, we do those kind of services. We also do chronic disease management. So diabetes, hypertension, high cholesterol, all of those kind of chronic diseases. Management of those. We also do immunizations and health screenings and well checks, physicals for both work and sports and school, all of those kind of things, in addition to women's health services like PAPs and contraceptive surveillance and those kind of things. Our dental services would provide, sort of the full spectrum. They would do, the exams and prevention, the cleanings, and then the minor restoration, so fillings and whatnot, extractions, and then major restoration and removable restoration. So, if you're talking about root canals or crown and bridge, or even dentures, if you're talking about removable dentures, we pretty much do full service dentistry. And then at not every location, I think we've got access. We have a site in Nelsonville that covers Athens County and Hocking County. We have a site in MacArthur that covers Vinton County. And we have a site, some of our sites are outside of the board service area. Obviously, we have a dental site in Ross County here, one down in Meigs County, one that we're trying to get started up in Gallia County. So in terms of behavioral health care, that does the community psychiatric supportive treatment, CPST, as you may often hear it referred to. We also offer crisis services, outpatient counseling with therapists. We have psychiatry services, what would be considered as med-somatic services, where you have psychiatrists or psychiatric nurse practitioners prescribing meds. We have school-based services where we have therapists embedded in. You saw those 22 school locations on a prior slide. A lot of those are, they were relationships that Tri-County had set up with schools and added therapists in a lot of those schools across our service area. We also do substance abuse programs, youth partial hospitalization or day treatment, which is our REACH program. We have a site in Nelsonville that covers Athens, Hocking-Vinton. We also have one over in Washington County in the Barlow-Vinton area, and we're trying to get one of those started up down on the Calumet line to serve that portion of the service area. Our early childhood programs, we also do some of that community supportive type of programming and trainings in addition to that with parents and families. We do early childhood mental health consultation, across to a lot of boards of DD across the service area. In addition, we have Help Me Grow and our Women, Infants, and Children program, WIC. We have that in 2 counties, which is the Athens and Perry County. So next slide. This is a SAMHSA model that, David, I'm sure could speak to more eloquently than I, but it talks about the 8 dimensions of wellness. And when some of the things we've talked about, it's like physical health, oral health, behavioral health, it's all health, it's all health care. And sort of the overlapping sections of that, you have emotional, spiritual, intellectual, physical, environmental, financial, occupational, and social. And then you can see there that, so that's really sort of a total wellness. You sort of need each of those components. And if any one of those is missing, then it may impact other areas. But you can see that David listed out each of the services there that we provide that sort of address each of those components. You see that the therapy and case management appear in many of them because those services do cover, they're such a broad spectrum of services. But you do see also that we have some subcontracts with like Athens Photographic Project there and Natural Freedom, which does equine therapy, that gets into more of that physical and intellectual kind of pieces. I'm trying to think if there's anything else here that's worth, I won't rattle off all the different pieces there because like I said, David could probably speak to this slide more than I, but some of the other programs in the social there, you can see First Episode Psychosis, which is a program that we've been working on for a number of years. We also have a zero suicide program that we've been working on. Part of the crisis things that we're going to be doing going forward is the national 988 line that's supposed to come on later this summer. So that'll be us that's responsible for that across our service area. So, and I think that may be the last slide. There is a booklet that goes into a lot more detail, and certainly we could have spent more time talking about, HRSA program requirements in any of those sections. But this is David's contact information. Like I say, he had planned on being here today, but it wasn't able to. His contact information is there, and I know that Sherry is often at your board meetings there and gives updates for the agency. So any questions? I guess I'll stop there. I'm not sure how it's done on time, but I'll stop there and see if there are questions.